How do we each play a role in determining the course of an injured worker's recovery? What happens if a doctor deviates from evidence-based medicine or doesn't effectively communicate the treatment plan? Or when a patient doesn't adhere to the prescribed therapy? More importantly, what can happen if they do? How can the decisions we make as individual stakeholders change the course of a claim? Let's take a look.
Please have a seat, Lucinda.
Thank you.
I just want to go over a few things with you before you see the doctor.
Okay.
Okay, so you were complaining of neck pain, is that right?
Yes, that's right.
It's been about 18 months now?
More or less. I don't really remember exactly when it started.
How bad is the pain now on a scale of 1 to 10?
I don't know. I'd say about a 6.
Well, the doctor will be with you in just a moment.
Okay. Thank you.
Hi, Lucinda.
Hi, Dr. DeGrassi.
I've got your MRI results here.
And?
The MRI reveals a herniated disc in your neck. That disc is putting pressure on a nerve root. We can alleviate that pressure through surgery. I'd like to get you into surgery as soon as possible.
Surgery? Oh, I didn't think it was going to come to that. What's the recovery time on that going to be?
I don't see why you won't be back to work in 4 to 6 weeks. We'll give you some exercises to do and enough painkillers so you won't be uncomfortable as you recover. I'd like you to check with Angela in appointments before you leave.
I can't believe I need surgery. This really scares me. I just want this pain to stop so I can get back to my normal life again.
Hi, Lucinda.
Hi, Dr. DeGrassi.
I've got your MRI results here.
And?
What the MRI showed us that the x-rays didn't is that you've got a slightly herniated disc in your neck that's pinching a nerve root.
And this means?
It's a condition we'll have to monitor, and it may eventually require surgery.
Surgery?
Definitely not now, Lucinda. I want you to attend physical therapy. But if your condition does not improve in therapy, then yes, we may need to consider surgery.
Well, this pain is unending, and it's been almost 2 years, so can you prescribe me something stronger than ibuprofen?
Not at this time, but I'll write you a script for therapy.
I can't believe he won't give me something stronger to help with my pain. It's just gonna get worse. This physical therapy is never gonna work. How can therapy help this pain? I need meds for that.
Hi, Lucinda.
Hi, Dr. DeGrassi.
I have the results of your MRI.
And?
Lucinda, look, I can see this is a little unsettling. Take a deep breath. Your condition is manageable, and we're going to manage it.
Okay, so...
And what the MRI showed us that the x-ray didn't is that you've got a slightly herniated disc in your neck. It could be pinching a nerve root.
And what does this mean?
Well, the disc in between 2 vertebrae could be putting pressure upon the nerve root, and it possibly could be causing your pain. For starters, I want to get you into a physical therapy program. I want to strengthen your neck and see if we can take some of the pressure off of the nerve root.
Okay, so how often would I need to go?
I want you to go 2 to 3 times a week for at least 6 weeks. Now in therapy, you'll receive guidance on exercises that you can do at home, and this will help your situation. Lucinda, I'm confident you will have a good outcome here. You'd be surprised on how much progress can be made in physical therapy. I know you take a keen interest in your health. I think you're going to do well in therapy.
Okay, thank you.
Now, I'd like you to get with Angela, and she'll set up an appointment in a couple weeks, and you come back and see me.
Okay.
All right?
All right.
Remember, it's manageable.
Okay.
I'm looking forward to starting PT. I think that just might help me.
How can we make the right decisions for an injured worker unless we have the right information? All relevant information is needed in order to provide a more accurate picture of a patient's health.
I've got this patient. He's 53. Man, is he worrying me.
What's the story?
It's not a good one. He's very overweight, very high blood pressure. He says he's not a substance abuser, but I'm not so sure.
What's he on, can you say?
He's on oxycodone, an NSAID to reduce inflammation, and carisoprodol. He's also on a laxative, constipation from the analgesic. I've also got him on alprazolam, fluoxetine, and metoprolol for his hypertension. But like I said, I have no idea what the entire mix is. I could swear he's a big drinker, but he denies it.
Where there's smoke, there's usually fire in these cases.
I'm afraid so. I need better transparency into what's going on with this guy. That much I do know.
Only through communication can we expect to achieve optimal outcomes. When stakeholders fail to communicate, even well-intentioned decisions can have negative consequences.
So, how do you feel?
Well, I have good days and bad days, I can tell you. It's like the physical therapy helps, but then the pain is as bad as it was at the beginning.
If you really stick to the PT, you can get results you might not have thought possible going in. So, do you feel ready to get back to work?
Oh, I really don't know if I want to go whole hog on the lifting, Doc.
No heavy lifting, none at all. And no shovel work or other physical labor. Just stick to light duty. And let's keep you on ibuprofen just to cut down on the swelling.
Okay. All right. Thanks, Dr. Trumbo.
It's the bottom of the 8th inning, and so far it's been a very tight game.
Hello?
Hey, Rudy, how's it going?
Not much, boss. What's going on?
Same old thing, same drill for the past 2 years, man. Short on manpower, we got plenty to do. I don't know how I'm gonna get it done or who I'm gonna get it done with. Listen, I spoke with your doctor and the adjuster from the insurance company, and
What'd they say?
well, in their opinion, you're clear to come back to work. No heavy lifting or anything like that, but you can come back Monday. Hello?
Yeah, I'm here.
You don't sound too excited about that.
Well, I just don't know how they would know whether I'm good to go back to work. It's not like I'm 100% or anything.
Well, Rudy, it's the best thing for you, man. They've assessed you, and they think you can return to light duty. You still there?
Yeah, I'm here. Okay. I'll see you Monday come hell or high water.
Okay, well, sounds good. Have a good weekend, Rudy.
Yeah, see you Monday. Those insurance people, they don't know me from Adam. Screw it.
Screw what?
This. I can't believe they had me driving this thing already. Those pen pushers never drove a truck a day in their life. They don't know what my back can handle.
Yeah, but you know what it's about, brother. Dinero. They didn't have enough workers for the job. They bid it anyway.
That's BS.
Well, hang in there, big guy.
Well, here goes nothing.